Hello, and thank you for joining us here today. My name is Dr. Morgan Pomerantz. I'm a bariatric surgeon and the medical director of bariatrics at St. Rose Dominican San Martin Hospital.
And I am Dr. Poonam Patel. I'm also a bariatric surgeon and the chief of surgery at St. Rose Dominican San Martin Hospital.
It's my pleasure to talk to you today about the incredible work that we do. I know that choosing to view a webinar about weight loss surgery can be a big step. Maybe you've been considering it for a while, maybe you're just starting to explore your options, or maybe you're just here because someone you care about is thinking about it. Whatever brought you here, thank you for investing this time in learning more about a very important part of improving health and well-being. My goal is to give you a clear, straightforward overview of what bariatric surgery is all about. We'll talk about who it's for, what the different types of surgeries are, and what your journey with us would look like. I promise to keep it understandable, no complicated medical jargon where it's not necessary. My journey into medicine actually started with a fascination for how the human body works and how we can support it to be its healthiest. After medical school, I pursued specialized training in general surgery. During my surgical residency, I saw firsthand just how much obesity could impact a person's life, their energy, their ability to move freely, even their confidence. It really struck me how many major health issues were directly linked to obesity. I then decided to pursue even further subspecialized training in bariatric and minimally invasive surgery, specifically to focus on helping people struggling with severe obesity. What I love most about what I do is seeing the incredible transformations. It's not just about patients losing pounds, it's about them gaining energy, getting off medications for diabetes and high blood pressure and so much more. It's about people getting their lives back. It's incredibly rewarding to be a part of that, and I'm very proud to be a part of the compassionate team here at San Martin.
So, let's get into the big question. Is bariatric surgery right for you? Now, when people hear weight loss surgery, some might think it's a quick fix or an easy way out. Let me be clear, it's not. Bariatric surgery is a powerful tool, but it works best when you combine it with commitments to healthier eating and regular physical activity. Think of it like this. A high-performance car is amazing, but it still needs the right fuel and a skilled driver. Generally, we look at a few main criteria to determine if someone is a good candidate. The primary one is your body mass index, or BMI. This is a measure of your weight relative to your height. If your BMI is 40 or higher, you typically qualify. If your BMI is between 35 and 39.9, you might still qualify, especially if you have other serious health problems directly caused or made worse by your weight. We call these comorbidities.
Now, what are some of these common comorbidities? These are health issues that often dramatically improve or even go away entirely after a successful weight loss from bariatric surgery. The big ones we frequently see include type 2 diabetes, which is when your body struggles to control blood sugar, high blood pressure or hypertension, sleep apnea, where you temporarily stop breathing during sleep, high cholesterol, which is an unhealthy level of fats in your blood, arthritis or joint pain, particularly in your knees, your hips, your back from carrying excess weight, and heart disease, just to name a few. Basically, if your weight is significantly impacting your health and limits your ability to live the life you want, and if you've already tried other weight loss methods without long-term success, then bariatric surgery could be an incredibly effective option for you. Once we determine that surgery is a good path, the next step is understanding the different types. It can sound a bit overwhelming at first, but don't worry, we will simplify it. The two most common and effective procedures performed in the United States are the sleeve gastrectomy and the Roux-en-Y gastric bypass. Let's start with the sleeve gastrectomy, sometimes called a vertical sleeve gastrectomy, VSG, or just sleeve. This is currently the most frequently performed bariatric surgery. Imagine your stomach as a large, stretchy pouch. With this surgery, we permanently remove about 80% or 2/3 of your stomach, leaving a much smaller tube or sleeve or banana-shaped stomach behind.
So how does this help you lose weight? First, with a much smaller stomach, you simply can't eat as much food at one time. You feel fuller much faster, but there's another really important part. The portion of the stomach we remove alters some of the gut hormones. Levels of GLP-1 go up, which helps with feeling full and regulating blood sugar. Levels of ghrelin go down, which means you feel less hungry and more satisfied with smaller portions. This is the big advantage. The other common surgery is the Roux-en-Y gastric bypass. This procedure is a bit more complex and involves two main changes. First, we create a very small pouch at the top of your stomach. This pouch is tiny, only about the size of an egg. Just like with the sleeve, this significantly limits how much food you can eat at one time. Then, we bypass a section of your small intestine. We connect that new small pouch directly to a lower part of your small intestine. This means food bypasses a significant portion of your usual digestive tract.
Why bypass part of the intestine? It does two important things. First, it means your body absorbs fewer calories and nutrients from the food you eat. Second, and crucially, it leads to powerful changes in your hunger and fullness hormones, similar to the sleeve. The combination of decreased absorption and hormonal shifts is a big reason why the gastric bypass is incredibly effective for treating conditions like type 2 diabetes, often leading to rapid improvement or even complete remission. Both of these surgeries offer distinct advantages, and we'd help you determine which might be the best for you. But what are the overall benefits a person can expect from bariatric surgery? The benefits are truly life-changing for so many of my patients. Of course, the most visible benefit is significant and sustained weight loss, but beyond the number on the scale, we consistently see dramatic improvement or resolution of those comorbidities. Diabetes, high blood pressure, sleep apnea, and cholesterol often get much better or even go away completely. It's incredibly rewarding to see these patients come off their medications. We see increased energy and mobility. It's easier to move, walk, exercise, and participate in activities you enjoy. Many patients describe feeling years younger. We see improved quality of life. Patients frequently report better mood, higher self-esteem, reduced anxiety and depression, and much more active social lives. We see a reduced risk of certain cancers. Obesity is directly linked to many types of cancer, and weight loss can significantly lower that risk. We see improvement in menstrual irregularities, PCOS, and infertility issues. Overall, longer, healthier life. By addressing the root cause of many health issues, bariatric surgery truly extends and improves a person's life trajectory.
This isn't just about losing weight. It's about gaining health, regaining control, and improving your overall well-being. It's about becoming the person you know you can be. Now, you might be thinking, what does the actual process look like? It's definitely not just one doctor's visit and surgery. It's a comprehensive program, and that's actually one of its greatest strengths. We believe in setting our patients up for the best possible long-term success, and that involves a true team approach before and after.
Your journey with Dignity Health Bariatrics will involve a dedicated team of experts, including your bariatric surgeon, like me. I'll be guiding you through the medical and surgical aspects of the process. A dietitian or nutritionist, they are crucial for helping you learn new eating habits, what to eat before and after surgery, and how to get all the important nutrients you need. A psychologist or behavioral health specialist, they help you explore your relationship with food, develop healthy coping strategies, and prepare mentally for the significant changes ahead. A bariatric coordinator, this person is often your primary guide through the entire process, helping you with scheduling, insurance, and answering certain questions. And most importantly, you. Your active participation and commitment are absolutely key to your success. The process typically starts with a thorough medical evaluation. We'll review your medical history, perform necessary tests, and make absolutely sure you're a good candidate from a health perspective. You'll also have several consultations and education sessions with a dietitian and psychologist. This pre-surgery phase is incredibly important. It's where you gather the tools and skills you'll need for long-term success. We want you to feel fully prepared and confident walking into surgery. On the day of surgery, you'll be in excellent hands here at San Martin Hospital, which is an accredited center of excellence in metabolic and bariatric surgery. Our surgeries are exclusively performed using minimally invasive techniques, often called laparoscopic surgery, which means small incisions with a long camera and instruments. We often use robotic-assisted surgery technology as part of our cutting-edge laparoscopic toolset and have earned San Martin an accreditation as a center of excellence in robotic surgery as well. Laparoscopy, combined with our enhanced recovery after surgery protocols, lead to less pain, less nausea, and a faster recovery. Most patients stay in the hospital for about one night after surgery. Once you're home, recovery usually takes a few weeks to feel fully back to normal, but you'll be able to walk around and get moving right away. Most people return to light work and exercise within 1 to 2 weeks. It's important to remember that surgery is not the end of the journey, but a new beginning.
And that leads to a common question. What happens after surgery? Am I on my own? Definitely not. Post-op is where the real work of establishing lifelong healthy habits truly begins, and we are with you every step of the way. We'll schedule regular follow-up appointments with your surgeon, dietitian, and other team members right away, and indefinitely for years to come. We'll monitor your progress, help you continue to adjust your eating, and ensure you're getting all the vitamins and minerals you need, as supplementation is crucial after these procedures. We also offer support groups, which are incredibly valuable. It's a fantastic opportunity to connect with others who are going through similar experiences, share tips, and celebrate successes. This isn't a quick fix. It's a comprehensive program for true sustainable lifestyle change. and we provide robust, ongoing support to help you maintain that change for the rest of your life.
Being the medical director of bariatrics at San Martin Hospital isn't just a title, it's a deep commitment. It means I'm responsible for overseeing every aspect of our bariatric program, ensuring we consistently deliver the highest standard of care to every single patient who walks through our doors. And speaking of those standards, you should know that San Martin Hospital is an accredited center as part of the American College of Surgeons Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program, MBSAQIP. These aren't just fancy designations that we bought. It means that we've undergone rigorous, independent review processes by external organizations. They scrutinize everything from our surgical outcomes and safety protocols to our patient education programs and long-term support. They ensure we don't just meet, but exceed national benchmarks for quality. What does that mean for you, the patient? It means when you choose San Martin Hospital, you're choosing a program that has demonstrably proven its expertise. You're choosing highly experienced surgeons, like myself. Our surgical team has performed a significant number of these complex procedures, refining our skills and techniques over many years. You're choosing a dedicated, specialized team. Our nurses, dietitians, psychologists, patient navigators, even our administrative staff are all specifically trained in bariatric care. They understand your unique needs and challenges. You're choosing state-of-the-art facilities. We have operating rooms, recovery suites, and even hospital rooms designed with the comfort and safety of bariatric patients in mind. You're choosing a comprehensive approach. We understand that surgery is just one piece of this puzzle. Our program encompasses in-depth pre-surgical education, personalized nutrition counseling, psychological support, and meticulous long-term follow-up. We guide you through every single step.
San Martin Hospital holds another significant distinction that directly benefits our bariatric patients. We are also accredited by the SRC as a Center of Excellence in Robotic Surgery. Now, what does being a Center of Excellence in Robotic Surgery mean? And more importantly, how does it benefit you, especially if you're considering bariatric surgery? Think of it this way. Robotic surgery is the cutting edge of minimally invasive surgery. Instead of just one large incision, we use multiple smaller incisions, just like traditional laparoscopic surgery. But with robotics, the surgeon, like myself, sits at a console in the operating room, controlling advanced robotic arms that hold miniature instruments and a high-definition 3D camera. Being a Center of Excellence in Robotic Surgery directly translates into better outcomes for our bariatric patients because of enhanced precision, dexterity, improved visualization, and less pain, resulting in faster recovery for most patients. Being a Center of Excellence in both bariatric and robotic surgery means we offer you the very best of both worlds, a proven, comprehensive program focused on your success, combined with the most advanced surgical technology available. It allows us to perform your bariatric procedure with an unparalleled level of accuracy and safety, which directly contributes to a smoother recovery and better long-term results for you.
When you choose Dignity Health Bariatrics for your weight loss journey, you're not just choosing a highly experienced team. You're choosing a hospital that invests in leading-edge technology to give you the safest, most effective, and most comfortable surgical experience possible. We are committed to leveraging every advantage to help you achieve your health goals. To wrap up, I want to reiterate why I believe bariatric surgery is such a valuable option for so many. For me, it truly comes down to seeing people get their lives back. I've had patients who struggled with simple tasks like tying their shoes, and now they're hiking, some even running marathons or playing actively with their children and grandchildren. Patients who were tethered to insulin injections for diabetes, now entirely medication-free. People who felt isolated and self-conscious, now embracing social activities, pursuing new hobbies, and finding joy in everyday life. It is absolutely not an easy road. It never is, and it requires commitment and hard work from you. But for the right person, it provides a powerful restart, a chance to improve their health in ways that traditional dieting and popular weight loss medications often can't achieve long-term. It's about empowering people to live a fuller, healthier, and happier life.
And as your surgeon, it is truly my privilege to be a part of that journey with you, my patient, here at Dignity Health Bariatrics.